I have to admit that it's quite a surprise for us how many of you already came back to the room before it was time to continue with our next presentation. So thank you very much for being so punctual. And also now in these last two sessions of the conference, you will hear some very insightful information on the upcoming plans regarding the brain health cooperation in Europe. I would like to add that during these past sessions and past day, we heard quite a lot about the challenges, the present situation. And now it's time to move on and look into the future a little bit. So I would like to invite our first speaker for this afternoon session, Tim Raemaekers from the European Commission.
Thank you.
Tim? And yes, you can change with the big button.
Yeah, okay, super, thank you. Okay. Hello, everybody. Yeah, thank you for the invitation. My name is Tim Raemaekers. I'm a policy officer in the Combating Diseases Unit in DG Research and Innovation. And I'll provide an update on brain research in Horizon Europe with a focus on the European Partnership for Brain Health, which is currently under development. Okay, so the previous speakers already touched upon the challenges and urgent needs in the area, and also did my director in the opening session yesterday. So I'll be brief here on our perspective. But because brain disorders are complex, multifactorial disorders, we need to foster a collaboration between multiple stakeholders. Researchers, clinicians, patients, payers, regulators, and others need to work better together to address the challenges together. Access to research infrastructures and resources and the sustainability of resources needs to be improved. Resources are not abundant, and we need to capitalize on what already exists. So we need to further structure the brain research area and ensure that all stakeholders work together in an efficient manner. If you want to conduct impact-driven research, to develop solutions that are needed, we need to involve those who are concerned the most, the patients and caregivers. We need to involve patients in the full process of research, from concept generation to implementation and uptake of results. So Europe is good at producing excellent research, but less good in transforming the results in technologies and products. And there's an urgent need to tackle this, especially with all these recent strategic reports, like you know, the Mario Draghi report and many others on the future of Europe. So there's urgent action to do in this area. Okay, as brain disorders are a leading cause of disability in Europe and worldwide, and because they pose a great burden on patients, families, caregivers, and healthcare systems, brain research has been a long-standing priority for the EU. Despite recent advances in research, there's still many unmet medical needs, with many best-performing drugs showing modest efficacy and non-negligible side effects. Other challenges include the rapidly growing impact of an aging population and simply the complexity of the brain. And more well-coordinated research and innovation is needed to deliver improved and personalized solutions, and for patients and healthcare professionals, as well as better evidence for policymakers. So the current framework program for research and innovation, Horizon Europe, started in 2021. And we wanted the program to have more impact for patients, citizens, and society. And a novelty was to push for more synergies with other EU programs, like the EU for Health program with the various initiatives, like the Healthier Together initiative, or the comprehensive approach to mental health initiative. Now, the Horizon Europe program was co-created with a number of key partners, stakeholders. There were public consultations with stakeholders, for example, the European Research and Innovation Days. There were consultations with member states to identify priority areas to invest in at EU level. And there were also consultations with colleagues in the Commission on where there were gaps in evidence that needed to be filled, also for policy making. Yeah. So Horizon Europe should lead to a more effective uptake of results for better prevention, diagnosis, and treatment strategies for brain disorders. And as you can see on the chart here, there are 3 pillars and a horizontal part on widening participation and strengthening the research area. Pillar 1 on excellent science responds to the need for more basic research and improved access to research infrastructures. And the ERC, the European Research Council, plays an important role herein as a bottom-up way to fund research. Pillar 2 on global challenges and European industrial competitiveness is aimed at improving collaboration. Pillar 3 on Innovative Europe seeks to boost innovation, trying to replicate the success of what the ERC, the European Research Council, achieved, but then in the innovation area. Now going into a bit more detail on Pillar 2 of Horizon Europe, this pillar addresses the need to improve collaboration, and it holds the large collaborative projects. And this is needed because of the multifactorial nature of diseases and the need to have researchers in different disciplines working together. And a number of partnerships have also been funded under Pillar 2. There's the key public-private partnership, the Innovative Health Initiative, which also has a key focus area in the brain research area. And like many of you may know already, it goes beyond, IHI goes beyond its predecessor, which was IMI, and it not only involves the pharma industry, but also medtech, the biotech, the digital industries. And the approach of having these different sectors working together should accelerate the development of innovative products. Now, with the adoption of the second strategic plan in March this year, we saw the launch of preparations for the public partnership, the European Partnership for Brain Health. And I'll get back to this in a moment, but for now I will add that it's a very ambitious partnership. It's taking a holistic approach, covering both mental health and neurological health. And key partners of the partnership, of the new partnership, of course, include the public-public partnerships, Neuron, the network of European funding for neuroscience research, and JPND, the joint program on neurodegenerative disease research. Now, in the next slide, you can see recently funded EU initiatives together in a timeline up to the expected start of the Brain Health Partnership, which is all the way to the right. And these initiatives cover a variety of actions, coordination and support actions, what we call ARANET co-fund actions, this future and emerging technology project, and the main output of this FET project, the digital research infrastructure. So on the coordination support actions, at the bottom you will see EBRA, and this was a CSA which first started to integrate the different initiatives together. And on the right top in purple, you'll see the brain health coordination and support action, which is currently ongoing and is preparing the partnership. Then on ARANETs, which are supporting Neuron and JPND, we have the Neuron Co-Fund 1 and 2, and then the JP Co-Fund 1 and 2. yeah, then there are also the flag areas which were supporting the Human Brain Project. And the Human Brain Project is this FET project, this Future and Emerging Technology Project, and eBrains being its digital research infrastructure, or the outcome being, a main outcome of that being that. So many of these activities will be coming to a close towards the end of 25, and in the first quarter of 26, the new Brain Health Partnership is expected to start. So as you can see on this slide, it's and as I just mentioned, it's expected to start in the first quarter of 2026, and its expected duration is 7 years, plus an additional 3 years for the runtime of the last projects. And the idea behind the partnership is to put the existing EU-supported initiatives together under one umbrella, so JPND, Neuron, and eBrains, the digital research infrastructure. Additionally, the aim is to go much broader with integration and to build this solid ecosystem for brain health research that should deliver on the many unmet needs. Needs of patients, prevention, facilitating translational research, development of clinical guidelines, diagnostics, therapies, and cures. So we need to align efforts and funding from member states and associated countries in the brain health research area under one strategic research and innovation agenda. And this agenda should facilitate working together and achieve synergy so that we can deliver more ambitious results and have, obviously, a greater impact. So we need to capitalize on the existing initiatives, bring them closer together, and strengthen also links with other entities, other relevant partnerships, rare disease partnership, Area for Health partnership, IHI, other infrastructures that also gave presentations today, BBMRI, patient advocacy groups, scientific society, citizens. And the partnership should have clear objectives and ambitious scope and goals. And member states and associated countries really need to support it as it's about fostering European brain health research. And of course, there will also be EU funding for the partnership. Now, so the goals of the partnership are framed within the UN Sustainable Development Goal Target 3.4 on non-communicable diseases and mental health. And the partnership also needs to work together with the other EU initiatives like as I had mentioned earlier, the Healthier Together EU Non-Communicable Disease Initiative, which runs from 2022 to 2027. And it has 5 strands, one of them being on mental health and neurological disorders. And then there's obviously there's the recent Commission communication on a comprehensive approach to mental health. So that initiative is also really important. To deliver on impact and in light of the focus on European competitiveness, the partnership should also aim to ensure research results are maximally exploited. Okay. So, this EU-supported coordination and support action, CSA Brain Health, which you will, of course, you've already heard about and you will hear about more very soon, is paving the way to the partnership. It started in 2023, in November, and it's tasked in developing the strategic research and innovation agenda, the implementation plan, and the governance structure. And the lead entity is DLR-PT, the project management agency of DLR, the German research organization. And they have already developed a strategic research and innovation agenda, and you will hear of it very soon from Catherine. And it's been validated by the stakeholders. And the last two, so the implementation plan and the governance structure is still is under development. So on this slide, which I also adapted from Ulrike's presentation, I'm not going to go into this because this will be discussed very soon. So you will hear more of these priorities in a moment. I will go a bit more in this area here. So the partnership needs to deliver on the priorities in the strategic research and innovation agenda. but it should also deliver on the, it needs to deliver on the new political priorities. And our Commission President, Ursula von der Leyen, presented to the Parliament in July the political guidelines for the next European Commission, 2024 to 2029. This was in July. And the ambitions that are set in those guidelines are also reflected in the portfolios of the new commissioners. And so obviously, particularly the relevant ones are the mission letters of the Commissioner for Startups, Research and Innovation, which is Ekaterina Saharieva, and the Commissioner for Health and Animal Welfare, Oliver Varhelyi. On overarching priorities, the central theme is competitiveness, with a plan to put research and innovation at the heart of our economy. And the resilient economy and defense and security are also important themes. On priorities in the area of brain health, focus areas include preventive health, in particular for mental health also including at work, and especially also for the young with regard to the impact of social media. Also on treatments for neurodegenerative diseases, and on research on autism. And this all reflects, the declining mental health of the European population, the impact of the aging population, and the fast rising prevalence of autism spectrum disorders, especially among children. And so the idea is to use what the European Beating Cancer Plan approach in these various areas, using various flagship initiatives and supporting actions which still need to be worked out, will still need to be defined. And it will likely include use of new technologies and research innovation at the service for prevention and care, sustainable prevention, screening schemes, ensuring access to high standards in diagnosis, treatment, improving quality of life for patients, and reducing inequalities. And the recent strategic reports also point to the urgent need to make Europe an attractive place for conducting clinical research. So this is also, the partnership should also take steps in this direction. Okay, to round up my presentation and to circle back to what I had said earlier, the Commission aims to have a partnership delivering a solid ecosystem for brain research that delivers on the many unmet needs of the brain area. And this also means that the partnership should aim to transform research discoveries as efficiently as possible to valuable, innovative products or services that matter the most to patients and citizens and society. And currently there are ongoing discussions with member states and associated countries on the different planned activities of the partnership, and we hope to reach an agreement on this very soon. And just a last slide here, just to keep you informed. We invite you to consult these websites. In March this year, we had the European Research and Innovation Days. There were sessions linked to mental health there. Then there was, the last Health Info Day was held in June 23, but the next one will be held in May 2025. But there are recordings available, which are also, very useful. And with that, I'd like to end the presentation. Thank you for the attention.